After giving birth, upbirth test should be done by the nurse. It stands for appearance, pulse, grimace, activity of the baby, and respiration. This is done to see if there is other signs that may need extra medical care or emergency care to the baby. It is done twice. The first is at 1 minute after giving birth, and again for 5 minutes after birth.
Position the baby prone on the top of the mother's chest, skin-to-skin contact, meaning nakedly. Cover the baby with a sterile towel to remove the amniotic fluid, thus keeping the baby warm. Hold the baby while she or he is on the top of the mother's chest to keep the baby free from injury. Wait until the baby sucks the nipple. Check for the cessation of the pulse of umbilical cord at least 1 to 3 minutes after the delivery. Clamp the cord with a sterile umbilical clamp 1 inch above the base of the umbilicus. Apply the second clamp 5 centimeters from the base of the umbilicus. Get your surgical scissor and cut the cord. Prepare a 1 cc syringe, dry cotton balls, and cotton balls with alcohol. Check the label of the medicines to be injected. Aspire 0.1 ml of vitamin K injection using a tuberculin syringe. Identify the baby by checking the identification band placed on the left or right foot of the baby. After disinfecting the area with sterile cotton balls with alcohol, inject the vitamin K on the left thigh and Hepa B on the right thigh. Make sure that when you're doing this, the baby is calm and not throwing tantrums. Place the baby in a flat surface. Get your tape measure. Pass the tape around the head to obtain circumference measurement. Your aim here is to place the tape measure and measure over the larger circumference of the head of the baby. It is usually above the eyebrow of the baby. If the baby is wearing a bonnet, make sure to remove that because it can alter the measurement of the head circumference of the baby. The normal measurement for the head is 33 to 35 centimeters or 13 to 14 inches. For the chest circumference, the normal measurement is 30 to 33 centimeters or 12 to 13 inches. The tape measurement will be placed at the level of the nipple of the baby. Pass the tape around the lower chest so that the mark is at the upper border of the tape. Make sure also that every time you are done measuring the circumference of the baby, you must record it right away to just avoid forgetting the data. Since I don't have a recumbent length, I will just be using a measuring tape. Place the measuring tape at the top of the head to the bottom of one of the heels of the baby and measure the length in centimeters. The average length of full-term babies is 20 inches or 50 centimeters. Put a lining and weighing scale and calibrate the scale to 0. Remove the draping, lambing, or any clothes of the baby including the bonnet and place the baby in the weighing scale, taking note of the weight in kilograms. Make sure that you are guiding the baby, especially when the baby is on tantrums. After that, wash your hands and record all the data.